Sharon Anderson is the Chief Population Health Officer and President of Christiana Care Care Link and the Senior Vice President for Quality and Patient Safety at Christiana Care Health System. Under her leadership, Christiana Care has achieved national recognition related to several patient safety and quality initiatives, including winning the prestigious 2017 John M. Eisenberg Award.
Our next speaker, Sharon Anderson. Welcome, Sharon.
Well, it's truly a privilege to be here today. I really appreciate the opportunity to talk about something I'm really passionate about, which is chronic disease. And it really does have an impact on healthcare costs. And by the end of this, you're going to see that this may be kind of the answer to a lot of our questions. So you've seen this pyramid slide in some previous presentations. This one really does reflect the health status of the U.S., where you have 35% of the population with no ongoing physical health needs. Then there's an at-risk population that they're at risk for developing chronic disease, or they have one chronic disease. Moving to the rising risk patients, 20% of the population with 2 to 4 chronic diseases, to the tip of the pyramid, which is our high-cost patients. The top 5% in this country drive 50% of our healthcare spend. And they have one thing in common: multiple chronic diseases. Chronic diseases are 7 of the top 10 causes of death. And most importantly, our hospitals are filled with chronic disease patients. 81% of all hospital admissions have to do with chronic disease. The issue around chronic disease is you can't just look at it from a clinical care perspective, and you'll see that chronic disease has other, probably more important factors: social and behavioral. The economic impact of chronic disease is just astounding. There's more than 75% of all healthcare costs are related to chronic disease. This is Medicare data. And if you look at the top 14%, drive 46% of all the Medicare spend. This is a population that has 6 or more chronic diseases. And the chronic diseases, it's the usual suspects: heart disease, cancer, mental health disorders, pulmonary conditions. 93% of all Medicare spending is for people with 2 or more chronic disease. Delaware, unfortunately, doesn't look any different. Chronic disease is the leading cause of death in the nation and in Delaware. Same diseases. The other issue is the Centers for Disease Control and Prevention estimates if we change 3 factors: poor diet, inactivity, and smoking, we would prevent 80% of heart disease and stroke, 80% of type 2 diabetes, and 40% of cancer. That really, this slide tells you kind of the answers to some of the questions we have. The health indicators for Delaware really don't look good. Percentage of diabetes, Delaware ranks 10 in the nation. Overdose deaths, 12. Hypertension, 12. Obesity, 10, and you can read the rest. And that is also an issue, is that we have health profession shortage in some of the key areas that we need health professions in: primary care, mental health, and dental. So my proposal is we need focused efforts. If we want to change the health costs in Delaware, we need to focus on chronic disease, on preventing it, on identifying it early, and really reducing the progression, and then also reducing the complications. And part of reducing the complications is empowering patients. Every day they wake up with their chronic disease. COPDers every day wake up unable to breathe. We have to empower them to care for themselves, to know when they're getting in trouble, to know how to take their medications, and to break down the behavioral and social barriers they have to actually improving their health status, regardless of where they are on the healthcare continuum. This is a really interesting slide. This slide is really the model that LA has, Wisconsin, several of the other states and counties across the country. And it really looks at health factors and what percentage of the health factors really impact health outcomes, morbidity and mortality. And as you can see, socioeconomic factors, 40%. And those factors include education, employment, income, family and social support, and community safety. Followed by health behaviors at 30%. Tobacco use, diet, exercise, alcohol use, and unsafe sex. Those two areas account for 70% of what we're seeing from a morbidity and mortality perspective. We have clinical care, access to care, quality care, only 20%, and physical environment, 10%. Again, we need programs and policies that help support this, but this is really our roadmap for how we're going to change the trajectory of costs in Delaware. We have to focus on the areas that actually drive chronic disease and really pay attention to them in a different way than we have in the past. At Christiana Care, we have been looking at different ways of taking care of our population and really this population health management approach. And we've launched a new program called Care Link Care Now. It's a wholly owned subsidiary of Christiana Care, and we think that this is the foundation for looking at different type of models of payment to make us successful in working with some of our partners. We have won awards for this program this year, and it really is about improving the outcomes and improving the quality of care that we deliver. And it really started about 5 years ago with the Centers for Medicare and Medicaid Innovation grant we received. We received a large grant, and we thought about how can we develop an IT-enabled care management platform so that we would know exactly where our members or our patients are at real time and do it in a very unique way. We have two innovations. One is the care management model, and you've heard a lot of the other speakers talk about team-based care. Healthcare is a team sport, and we do have a team at Care Link. It is including medical directors, pharmacists, nurse case managers, respiratory therapy, licensed clinical social workers. And our goal is to manage care across the continuum, and I'll talk a little bit more how we do that. We also address not just clinical, but the behavioral, and start to address the social determinants of health, but we cannot do that alone. The IT-enabled care management platform harnesses the power of the Delaware Health and Information Network. We have one of the most advanced HIEs in the country. So we get real-time feeds for our membership that tell us when the patient is registered, the second they register in an emergency department or in a hospital, or the second they get discharged. We also get notification on abnormal labs real time. So we can intervene. The concept of, can you engage a patient that's just been discharged from a hospital? Absolutely. They're engaged in their health at that point, and we engage them. We run a machine learning, artificial intelligence predictive engine, so we can identify patient need, the highest risk patients who need more intervention versus the lower risk patients that may need less of our intervention. So our model is really a virtual model. We run 2 virtual hubs, one in Newcastle County and one in Sussex County with those integrated teams. And we do manage the care across the continuum. We also have field-based teams in both of those locations where we go out into the field. If the member is living in a shelter, that's where we are. If the member wants to meet us in the McDonald's at the corner, that's where we go. If the member wants to, open their home to us, we will be in their home. And that membership usually is a population that has significant behavioral or mental health disorders, or maybe have huge addiction issues, or have huge socioeconomic challenges that have them with no housing. Our model also really is focused on empowering primary care to do the best job that they can, because primary care doctors don't have social workers in their office, or nurses, or pharmacists, and so what we provide is a team. The team is designated to the practice, becomes part of that practice, and this is really about relationships with providers and relationships with their patients, so that we really can start to address the full continuum of care, including behavioral issues, social issues, and clinical issues. I talk about care management being a really interesting concept. If you think about care delivery as bricks, they're usually bricks and mortar places where people go to care. So you go in for your physician visit, or you go into the hospital and you get discharged. And that matters a lot, but what matters maybe more is what happens after that care. And so care management becomes the mortar in between those bricks. And really, it's the longitudinal piece. It's after you saw the doctor, you have a new prescription, and you really didn't understand what the drug's supposed to do. Or you really can't afford it, but you didn't want to tell your doctor you can't afford it. Or you didn't know you couldn't afford it because you just picked it up at the pharmacy and realized it's not part of your plan. So what happens in between care matters a bunch, and that's really what CareLink is about, is supporting that longitudinal care in between those bricks and mortar visits. So we've been fortunate to grow CareLink. We started in 2015 with we have a 90-day bundle payment program with 7 diagnoses with CMS. And then that was in 2015, and over the last 2 years, we've really grown that to over 100,000 lives. The largest lives come from our eBright Health ACO. It started last year with 26,000 lives attributed to Medicare beneficiaries, and now we're over almost 48,000. We also manage our employees, spouses, and dependents at Christiana Care, and we also were fortunate to win for the state of Delaware, the Aetna product, HMO product, the Aetna A model, and we're managing 29,000 state of Delaware employees, spouses, and dependents. Our eBright Health ACO is probably, the foundation program. It really started to form a collaboration that is so valuable to all of our health systems. Christiana Care is part of it, Bay Health, Namaco, BB, and Atlantic General. And our employed physicians are in there, as well as community-based physicians in all 3 counties. And they are really, it's really formed an opportunity for us to learn together. I think the people that live in the various counties have different healthcare needs. I think the hospital systems have really addressed those in unique ways, and it really has been a great program. We have 281 primary care physicians in all 3 counties, 82 practice sites that support those 48,000 beneficiaries. In addition, recently the Moores is really going to send their expertise to us and really help us fill out our pediatric component of CareLink Care now, and so we're really excited about that opportunity to get really their expertise on how to manage clinical and behavioral and social aspects of pediatric care. I think now I have we're ready for the video. So I wanted to show a brief video to really show you what CareLink does in action. These are real patients and the physician provider that we support. It's only a 3-minute video.
There's so much to do in Delaware. So who needs to spend extra time thinking about their health care? With CareLink Care Now, we help people stay well, assisting those at risk to avoid chronic problems, and we help those with serious or chronic conditions do their best to manage them. It's a program that cares for you like family.
I'm a smoker, and I had cancer, and I have asthma.
He knows he can call me. I'm not going to judge him. We had talked about smoking cessation probably 9 months ago. At the time, he wasn't ready. And he called me after a doctor's appointment and said, my asthma's getting bad.
It's hard for me to breathe sometimes in the cold or in the hot air. It's hard for me to breathe.
Like, if you're ready to do this, I'm ready to help you.
I love it. I can trust her. I can depend on her being there. And I appreciate that.
At the heart of CareLink Care Now is the understanding that everyone is an individual. And sometimes patient needs go beyond a prescription.
Went to the doctors, had a blood test, and the doctor told me I was pre-diabetic.
When I first noticed that Susan's blood sugars were beginning to rise, she was very resistant to even hearing me tell her that.
I got a referral from Dr. Hora. She thought that she'd be a good person for me to talk to. Be okay?
The contact point was with an iPad that CareLink Care Now has put in the office.
We did a FaceTime interview.
Susan had mentioned that she doesn't want to take medicine.
She's had family members who have had some side effects from diabetes medication. She wants to try diet and exercise first.
Asked her if she wanted to talk to a nutritionist, and she expressed that willingness.
I always think about the actors and actresses. They have nutritionists, they have cooks for them. To me, it makes me feel like I'm important too, to get that same kind of support.
I think that CareLink Care Now has nurtured Susan to have more honest dialogue regarding her blood sugars.
They work with me and respect my wishes instead of telling me I have to do it.
Caring is one thing, coordination is another. Care Link Care Now's innovative model mines electronic health records, claims data, and real-time data feeds to simplify living for people with even the most complex medical histories.
At Care Link Care Now, we take care of you like neighbors should. We have a dedicated team of nurses, social workers, pharmacists that are there to partner with you to get you on a track that improves your life.
Care Link Care Now benefits doctors too. While there's no replacing your primary care physician, our team partners with him or her to take good care of you.
CareLink is a lot of good support. I think that CareLink provides an opportunity to kind of reach out to individuals and meet that person where they are.
So everybody's really busy. We're all running all over the place. We here at Care Link Care Now can bring you some comfort, encouragement. We make looking after yourself less of a job.
At Care Link Care Now, our job is simple, making medical care work the best it can for every single person. Giving you more time for the most important things. Care Link Care Now. Find out more today.
So I think that describes it better than I ever could. Just seeing the patients that we interact with every day, really dealing with the challenges that they face, working with our physician colleagues who face enormous challenges in trying to manage their population with limited resources in their office.
Care Link Care Now is a care management service provided to the community.
Yes, it's all
We're working with physician offices, we're working with health systems, we're working with the individuals here in our state to make a difference.
Okay. But I wanted to go back to that one slide without audio. So this slide, I really think that, and Secretary Odom Walker talks about these issues all the time. If your refrigerator is broken and you can't afford to refix your refrigerator, how are you going to keep your insulin from going bad? Or, if you're supposed to eat a healthy diet because you're now diabetic and you live in a food desert, how's that going to happen? So this is a heavy lift. I mean, the type of work that we have to do as a state is really heavy, and it's not just on healthcare providers, it's not just on the state, it's not just on patients, it's really all of us. If we're going to lower costs, we need to improve health. And this is a partnership. It's really state government, it's hospitals and providers, it's our patients, it's our payers, and it's really our community. This is all about this concept of a healthcare cost benchmark, and I think that we have to understand that we have an avalanche of chronic disease coming our way. If you look at the obesity rates of children, those children are going to become diabetic. I think diabetes is the precursor to all other diseases, because it is. And diabetes is very challenging to manage as an individual, whether it's your blood sugar, making sure you get your eye exams, making sure that you keep your hemoglobin A1C, you explain that to a person in control, taking multiple medications. So we have an avalanche coming our way, and we don't really know the cost that's going to be here, not necessarily in 5 years or 10 years. We're attracting older people to Delaware. They love to retire here, which is awesome, but older people then come with chronic disease. So I hope as we go forward in doing this work, that our measure isn't about how much it costs, for an amputation. I hope that our measure is how many amputations never occur because those diabetics are under control, or how much does it cost to do dialysis in a facility versus home dialysis. It really is about not having anybody on dialysis. Or how many NICU days, the length of stay, or the cost per day. It really is about, let's empty the NICU. So I think if we keep that as our focus, that if we improve health, we absolutely will lower costs. That's the goal. I think, we're going to get to the answer that we need to get to in doing this type of payment reform. Questions?